My name is Rebecca Burgman, LCSW. I have a private practice in Georgetown, Texas. I have been working with ETT for the past 18 months, and I have been a trauma specialist for the last 37 years. I learned about ETT from a fellow therapist who trained in EMDR like I did and found it to be a big help in really resolving trauma. I have found myself using much less EMDR. Yes, I will occasionally use it, but you cannot pick up the dissociation with EMDR or correct it as readily as you can with ETT, which is one of the reasons I really talk to other therapists about getting trained in this. I first started doing trauma work after I was trained by Francine Shapiro, who created EMDR. And I had been doing that for 32 years before I came upon ETT. What I love about ETT versus EMDR is that it accesses implicit memory, which is the part of the trauma that a patient cannot recall, but that the brain recorded. In my practice, I find ETT to be invaluable. I call it EMDR on steroids. I had a young woman in here this morning who had been with a therapist since she was 13 years old. She'd had significant trauma from her father. She's never done EMDR or ETT, no, only talk therapy. And she said to me, I dissociate a lot, especially from the trauma by my father. And I said, well, lucky for you, the technique we're going to do today is called emotional transformation therapy, ETT for short. And I will be able to do an assessment with the color chart behind me. We will work on every color band with your statement about, when I think about this trauma, I feel these feelings. The minute you dissociate, that color band is going to blur out. You will let me know it blurs. We're going to train your brain to quit dissociating. And she left so happy today that she was able to stop dissociating. She experienced that in a 1-hour session. With ETT and doing the chart work, which is an initial assessment, we're able to train the brain to stop dissociating. There is not a mechanism for that in EMDR in an initial assessment. With ETT, the precise visual stimulation, along with the attachment-based interpersonal psychotherapy, you access the implicit memory that the patient is unaware of that's related to the trauma. EMDR does not get to that, so you get a better resolution of the trauma with ETT. The beauty of the 4 modalities is that you get to access in 4 different ways the how the trauma got laid down in the body. Bessel van der Kolk wrote a book, The Body Holds the Score, and a lot of people are aware of that book, and that's how they learn about EMDR and study up on it. And EMDR certainly does address that, but not as specifically as ETT does. I recommend to all my therapist friends to get trained in this. I even recommended it to the Williamson County Therapist Group, and about 5 people from that group came and trained and are very excited about this modality. Well, even though people are getting better with other therapeutic modes, one thing with ETT, because it just works so quickly and thoroughly, is patients are excited. They talk about it to their friends and family, and then they're referring to you. So most of us are used to working for quite a while with patients, and with this, that may not be necessary. I think you're going to get to a faster resolution of trauma. I think you've got more modalities to work with. It's just a gift to therapists to be able to help others in the world that are suffering. And I'm always spreading the word about ETT because of its effectiveness.